Hey all, welcome to ShareTrek. This is Raj here, and I hope you had a great weekend. Today I want to talk about therapy called Cabenuva. It's a revolutionary long-acting therapy transforming HIV treatment. So in this video, you'll get to learn about its key features, benefits and challenges, as well as the potential implications for individuals living with HIV. We'll explore improved adherence, enhanced viral suppression, and patient-centered care that Cabenuva provides. We'll also uncover the future of HIV treatment and the impact of Cabenuva on long-term health outcomes for HIV patients. And this also kind of helps you stay informed on the groundbreaking advancement in combating the HIV epidemic. So that's what our video is all going to be about. So after talking about these things in the video, my next video on Cabenuva is going to be on how exactly it operates in your body, how it works within the human immune system in order to protect you from HIV. So I'm still reading up on those, so that will be the next video. So let's get started. And before we go ahead, I would like to request that if you have not yet subscribed, please subscribe. And we have a wonderful Patreon system, and you could join our Patreon account in various levels, and you can have different level of engagement with this channel. This is a unique channel which is providing HIV programming on YouTube on a consistent basis. Every Friday we have at least one video on HIV therapy or research, and we cover existing therapies as well as therapies under clinical trials. So it will be very nice to have you as a patron to support this channel. So please visit our Patreon. The link is in the description. Check that out and become a member and support us on Patreon. With that said, let's get started. Welcome back, friends. In recent years, significant advancements have been made in the field of HIV treatment, revolutionizing the life of millions affected by this chronic viral infection across the globe. Among these advancements is Cabenuva, a groundbreaking, long-acting therapy that has emerged as a game changer in managing HIV. Cabenuva offers a paradigm shift in the treatment by providing a monthly injectable regimen, eliminating the need for daily pill intake. This easy to use approach has a lot of benefits. This particular video today is going to explore the key features, benefits, challenges, and potential implications of Cabenuva in the context of HIV treatment and the overall well-being of individuals living with HIV. This is our first of many videos on Cabenuva, as we will go into details and updates in subsequent videos. The evolution of HIV treatment is the first point at which I would like to start. Over the past decades, the management of HIV has evolved tremendously, transitioning from complex medication regimens to more simplified approaches. Antiretroviral therapy, or ART as we call it, has been a cornerstone in suppressing viral replication, improving immune function, and significantly prolonging the lifespan of individuals with HIV. However, the adherence to a daily pill intake has remained a challenge for many, leading to treatment interruption and the risk of virologic failure, especially because when people are going through their daily life where they have to travel for work or they are indisposed, or they are in a place where they cannot access the medication, those things become a problem with daily intake of medicine. So a monthly regimen is way superior to a daily regimen. The next aspect I would like to talk about is the fact that Cabenuva was developed by ViiV Healthcare, and it's a novel long-acting injectable therapy that combines two potent antiretroviral drugs. The first of them is cabotegravir, and the second is rilpivirine. The treatment consists of two injections, one of each of these ingredients administered simultaneously once a month. And this approach provides a sustained release of drugs, maintaining effective drug levels in the body throughout the month, and thus suppressing the viral load. The benefits of Cabenuva can be categorized as improved adherence. First of all, by eliminating the need for daily pill intake, Cabenuva addresses a significant barrier in adherence. This long-acting therapy reduces the burden of remembering and taking multiple pills each day, improving treatment adherence and reducing the risk of viral breakthrough. For example, instead of a 365-day alertness, you just need 12-day alertness in the year in order to be safe, because Cabenuva is administered once a month instead of taking a tablet daily. So instead of 365 events in a year, you just have 12 events in a year that you have to keep track of. The next is convenience and quality of life. Cabenuva offers convenience, allowing individuals to live more freely without the constraints of a daily pill regimen. It alleviates concerns about carrying medication while traveling or maintaining privacy in public settings. This freedom enhances the quality of life, reduces stigma, and promotes overall well-being. And then we look at enhanced viral suppression, because clinical trials have demonstrated the efficacy of Cabenuva in achieving and maintaining viral suppression comparable to standard oral ART. Consistent viral suppression not only improves individual health, but also reduces the risk of transmitting the virus to others. So it has a dual benefit out there. And when we look at the challenges and consideration which are present in any therapy that you take, Cabenuva represents a significant advancement in HIV treatment, but there are some challenges that need to be addressed for its successful implementation. The first of them is typical of any of these kind of therapies, which are likely to be highly priced. The access and affordability is the first aspect. The accessibility and affordability of Cabenuva may be a barrier for many individuals, particularly in resource-limited settings, and efforts have to be made to ensure equitable access and explore cost-effective strategies to make this therapy widely available. The other adverse factor is the adverse effect and monitoring, because as you know, when FDA approves any of these HIV therapies, they do a long clinical research, but still the general population has got way more variations than the maximum that FDA can accommodate during its clinical trial. So ongoing monitoring is taking place of Cabenuva in order to make sure that adverse reactions and injection site reactions are recorded, and hypersensitivity is assessed and managed in order to ensure safety and well-being of individuals receiving this treatment. So those activities are ongoing to monitor how effective it is, and also to keep on studying whether it is continuing to be able to repress the virus, or if there are any strains which have gone resistant to Cabenuva. So those activities are ongoing, and they need to be ongoing. The other aspect I would like to talk about here is implications and future directions. The introduction of Cabenuva has far-reaching implications for HIV treatment and public health. Treatment as prevention is one of the things that I would like to talk about in case of implications. Cabotegravir's long-acting nature can enhance the concept of treatment as prevention. With consistent viral suppression, the risk of transmission is significantly reduced, contributing to the global efforts to end the HIV pandemic. And the very reduced incidence of HIV will again be suppressed further by using the same therapies, and ultimately it can lead to the eradication of HIV from humans. Then we are looking at the concept of patient-centric care. Cabenuva promotes patient-centric care by accommodating individual preferences and lifestyles. It allows healthcare providers to tailor treatment plans that align with the specific needs and goals of their patients, ultimately improving engagement and health outcomes. Overall, we can also say that research and innovation is taking place. The development of Cabenuva represents a milestone in the ongoing research and innovation in HIV treatment. It paves the way for further exploration of longer-acting therapies, more than a month. Like maybe you have to take an injection once in every 2 months, or maybe once in 6 months, or once in a year. Those are all the goals that are being set, and alternative drug delivery methods that can enhance treatment efficacy, adherence, and overall patient satisfactions are also being looked at. So this is a stepping stone. Cabenuva is a stepping stone in that direction. And in terms of long-term health outcome, as I mentioned earlier, Cabenuva is being studied on an ongoing basis to make sure that there are no adverse side effects, and that it continues to remain effective against HIV, and that there are no new strains of HIV that are resistant to Cabenuva. So those things are continuing to happen. So in conclusion, if I was to summarize everything that I have said so far, then I would say that Cabenuva has emerged as a groundbreaking advancement in management of HIV, offering a transformative approach to the treatment with its long-acting injectable therapy. By improving adherence, enhancing convenience, and providing viral suppression, Cabenuva has the potential to revolutionize HIV care, and contribute to the global efforts to combat the HIV epidemic. However, addressing challenges related to accessibility and affordability and monitoring remains crucial to ensure the widespread adoption and effectiveness of this innovative therapy. With ongoing research, innovation, and a patient-centered approach, Cabenuva opens up new possibilities for improved long-term health outcomes and well-being of individuals living with HIV. This also gives inspiration for other therapies that can come in future, which may be once in 2 months or once in 6 months or once in a year injection kind of therapies. So with that, my friends, I would like to bring this video to an end. And before you go, I would like to remind you, please check out the Patreon link in the description below and join our Patreon to help us continue with the HIV coverage on this channel and make this the only channel on YouTube that gives you consistent and ongoing HIV therapy coverage and a place for the community to gather together. Thanks and have a great day. Bye for now.